Today we're going to be focusing on the hip area, more specifically internal snapping hip syndrome. This is an injury that occurs most often in female dancers. Dancers and dance teachers to be aware of internal snapping hip syndrome and how it affects the ability to perform dance moves.
Here we can see the iliacus and the psoas muscle. Together, these two muscles form the iliopsoas muscle, which cross the hip joint and insert together at the lesser trochanter of the femur. Together, these two muscles are the strongest flexor of the hip. One of the main causes of internal snapping hip syndrome is tightness in the iliopsoas muscle. The iliopsoas is responsible for lifting and twisting the thigh. As we can see in this picture, this is a common position for dancers to be in due to the amount of emphasis put on external rotation. One cause of the snapping that is heard or felt in the hip is the iliopsoas tendon moving over the iliopectineal eminence, which is a rounded elevation seen here on the right side of the screen. It lies on the hip bone underneath the iliopsoas muscle. Another potential cause of the snapping sound heard in internal snapping hip syndrome is a tight rectus femoris, which is this long muscle right here. While the rectus femoris is best known as a quad muscle, it is also considered a hip flexor because it crosses the hip joint. When the rectus femoris is tight, it can create a snapping sound as it moves over the rounded head of the femur, which is this big ball right here, during the movement of flexion.
Overuse is one of the main causes of internal snapping hip syndrome. Dancers perform repetitive flexion, bringing the leg up to the torso while externally rotating the hip. Doing these movements over and over again puts a lot of load and strain on the muscles involved in these actions. Another reason for this injury occurring is muscle imbalances. Dancers do a lot of flexion, external rotation, and abduction. Without a regime of addressing the opposite movements of internal rotation and adduction, this can cause the further problems. A common characteristic of snapping hip syndrome is the snapping sound that is heard when going from extension to flexion and flexion to extension. Snapping hip syndrome can sometimes be painless, but when pain is felt, it is felt in the anterior hip. Modifications to dance moves and sometimes taking a break from dancing altogether may be needed. During this time, it is important to stretch and strengthen the muscles around the hip. When dancers are pain-free, they can resume dancing. Ideally, you want to include the following exercises and stretches into your daily strengthening protocols to help prevent internal snapping hip syndrome from occurring. First two strengthening exercises are used to strengthen the muscles around the hip. First exercise is the clamshell. You can use a resistant band like this or one like this and tie it up as tight as you need it. You're gonna put it around your legs, bring it up just past your knees. You're gonna put your feet together and your knees at 45 degrees, and you're gonna bring your legs apart. You will feel it in your glute and your hip area. Next, we have monster walks with a band. Feet facing forward, slight bend in the knees, and you're gonna take small steps while controlling your knees. Alternatively, for dancers, you can externally rotate and slight bend in the knees, and again, small steps, and this.
All right, the next exercise is targeting your core muscles. That's your center part of your body, and if there's any weakness and dysfunction at your core muscles, it's going to impact you on your whole body. All right, the first exercise is dead bug. So to perform a dead bug, you're going to lie down on your back and raise your legs up. Make sure it's 90-degree bent from your knee and your hips. Your knees are right under your hips, and you're lying down. Your core is tight, so your back is against the ground, and you're gonna raise your arms up, and you're gonna extend your arms and legs alternately like this, and focus on your core muscles. The core progression to a dead bug is a bird dog, and bird dog is really good for your rotary stability. And to perform a bird dog, your back is straight, and you're gonna raise up your hands and legs alternately together. And you can change, switch to your other side to balance out.
Along with strengthening, it is also important to stretch the muscles around the hip. First, we have a stretch for the piriformis. What you're gonna do is you're gonna lay on your back, you're gonna put either leg on top of your knee, you're gonna reach in behind, and you're gonna pull your knee in towards your torso. You wanna have a nice flat spine here, and you'll really feel it in your piriformis here. Next, we have an adductor stretch. You're gonna put your feet together, and you either let your feet hang if you feel it like this, or you can push down with your knees, and you will feel a stretch in your adductors here. Next, we have a hip flexor stretch. So like a lunge, get into a lunge position, and you want your hips to be parallel. And you really want to push with this hip forward, and you'll feel the stretch along the anterior of your hip. Because of how prevalent this injury is among female dancers, it is important for dancers and dance teachers to be aware of the signs and symptoms and rehab procedures. However, it is more important to be aware of the preventative measures that can be taken in order to avoid internal snapping hip syndrome from occurring.